Hello and thanks for joining me today on another sunshine/water edition of the Rehab Corner. And today I want to talk about a concept of shit in, shit out. The importance of inputs over outputs, and why if we focus more on the information that we're taking in, then we're automatically going to get better output on the back end. So sometimes from a PT rehab, strength and conditioning side, we're really focused on how to do things. How do you do exercises in terms of form or exercise selection? And I want to break down why this isn't always the best place to start mindset wise, with a simple analogy of cooking. And I think anyone can relate to this. We know that a great meal starts with not only a great process of how to prepare the food, but with the actual ingredients, right? In this case, in this example, the ingredients are the inputs, right? The great ingredients. So how you put that together is the process. That's the how. But the actual inputs in this case are the ingredients, okay? From a movement perspective, we have to think about how movement actually happens, okay? Most all movement, or actually pretty much all movement, is either generated by the brain or spinal cord in response to some sort of input from sensory systems, right? And so a reflex, if you go and step on a nail, okay, there is a sensory system that picks up that input. There's a local response to your spinal cord which makes you lift your leg, okay? That's one thing. Then you have other ones that aren't reflexes, that are more voluntary, which are happening with input from the environment, from our sensory systems, and then our brain is telling the rest of our body what to do below, okay? Or you have things that you know from the top, you're not relying as much on sensory input, and you're just saying, do this, do that, and there's an upper limit to how much you can just say from the top down without having any information in, okay? So instead of worrying about first and foremost how to do your, let's say, squat or whatever exercise you're doing, how about starting to think about what kind of information is my body getting about where I am in space prior to that, right? Because if you have an adequate amount of information coming in and your body can properly orient itself, then you're going to have a better shot at the output being good. Okay, so think back to the example I just gave with cooking. If you have crappy ingredients right from the start, I mean, you can be absolutely the best process oriented chef, and you might be able to add some spices and do some things on the back end to make it taste a little better, right? But the person who maybe has less spices or doesn't quite have as refined a process as you might, but has fresh ingredients from the garden and freshly imported specialty things to the dish, their dish is probably going to be better, even though their execution might not be quite as good. Okay, and so the same thing from a movement perspective. And in a second, I'll show you some examples of how you can start to work on some movements and maximize the inputs and get better inputs. And then I'll talk about some examples of some other areas of input that we don't necessarily think of as governing how we move, but if you start to think about how it's really organized at the level of the body and the brain, then you start to realize, oh wow, these areas are really important. So before we do that, I want to bring out a picture of a friend of mine, and this is Harry the homunculus. And a homunculus roughly translates to a small person, okay? And you can see this image here. And what you'll notice about this image right away is that it's almost like a caricature, right? So the face, the ears, the tongue, the lips, the eyes, the nose, and the hands are huge. Now, what is this picture really doing? This picture is describing the relative area of our somatosensory cortex in our brain, so the area of our brain that's responsible for taking in and integrating information from our senses. It's talking about what areas of our brain are represented in what amounts in that area of our brain, okay? What areas of our body, rather. So as you can see, the hands, lips, tongue, nose, ears, head, eyes are all huge, and the rest of the body is relatively small. So when we're talking about the body and we're talking about inputs, we want to maximize inputs that take up a lot of space in our brain, and also inputs that are frequently in contact with our environment. Okay, so let's take a squat as an example. When you're squatting, the only real inputs you have directly from your environment are the bottom of your feet. Okay, and that's about it. Maybe you have some information from your eyes about where you are in space, or your ears about where you are in space, or about position of other body segments above, right? But in terms of just the environment to you, all you have is your feet. So if you want to clean up someone's squat pattern, instead of just trying to focus on that process, right? Well, saute the onions this way, or do this way. How about thinking about inputs? So to think about an input in a squat, something really simple you can do, right? Think back to what I just showed you. The hands on that homunculus were huge. So if you take your hands and you put them on a surface like this, and then you squat down, you have just increased by an exponential factor the amount of sensory information about where you are to your body and to that area of the brain that integrates all that information. Okay, so that is a simple thing, but think about this. You just magnified the input just by putting your hands there. Okay, now I'm not only referencing through my feet, but also through my hands. Okay, now that is about as simple as it goes. And this is why if you're down in a yoga class doing a downward dog, guess what? You got hands on the floor, you got feet on the floor. If you're doing that kind of cat camel sort of business, you got hands on the floor, knees on the floor, and feet on the floor. So you have multiple points of reference that you're able to get more and better inputs in, so then the output has a better chance at being good on the back end. So that's just kind of an intro to, from a movement perspective, what you can do. And we'll talk more about referencing in another video, but what I want to bring up here is some other things that we don't think of as being as important to how we move that we often forget, and these are big, right? So you remember that homunculus. We had big lips, big nose, big face, big eyes, big teeth. Okay, you couldn't see the teeth there, but if you did, the teeth would be huge. Okay, and so if our head doesn't know where it is in space, and the inputs here are jumbled up because of a problem with contact in teeth, with a problem with how we're breathing that's changing the way that our body can sense our palate of our mouth, or the back of our throat, or our nasal passage, right? These are all areas that have a huge representation sensory-wise. So doing simple things like learning to breathe through your nose, making sure that your teeth are touching in the right way so you're seeing a good dentist, making sure that your eyes are working for you so you have the right glasses prescription and you're able to see both wide and focal, and not just staying on a computer all day, but also getting out and using your peripheral vision. Okay, look up, use that part of your visual field, not just always looking down, stapled that way. These are ways that you can get massive benefit on the input side of things without trying to focus too much on the outputs. And you would be very, very surprised how just getting more information in from proper teeth, proper tongue position and use, proper resonance through an oral and a palate, oral cavity and a palate, those things can clean up someone's squat in about 2 seconds. Okay, so how do we actually work on that? So the easiest way to start is to get proper tongue posture, get that up in the roof of the mouth. So I'm not just talking about the tip of the tongue, but the whole thing, lift it up into the roof of the mouth, and then breathing in gently through the nose and doing a long exhale through the nose, and do that all the time. That's number one. Number two is you want to get this whole cavity, your head, your cranium, you want it to be able to resonate. So I'm gonna cover up this microphone so it's not too loud. But one thing you can do is you can start to make a really nasal sound on the breath out and the breath in. So on the breath in, it's gonna be kind of like a vacuum. That's like a vacuum, and you notice I went out and I had the same sound coming in, right? So if you start to make that sound, and you can maybe start it with a N, G, and then the vowel you want. So if you want to get a real nasal sound, you can go NGE, right? And you can hear that's kind of nasally. So right there I could feel my palate, my oral and nasal cavities were resonating, okay? And then on the way in, I'm gonna do the same thing. And it's a totally gross sound. And you probably don't wanna do it when you're around anyone. But if you just practice, NGE, NGA sound, right? And you get your whole head resonating and you're keeping relaxed and you get all that resonance, you're getting a ton of information in. And what's interesting is in people that have sleep disordered breathing, sleep apnea, which is huge and on the rise, not just in the stereotypical demographics of people that are overweight, or older, but we're seeing it in younger people that have, some sort of history of orthodontics or some other breathing problem, asthma, and who are young and skinny and all sorts of stuff, but are having a problem snoring. And what they find with these people is they have decreased sensory input to the area in the back of their throat, right? The back of their nose and oral cavity, okay? And this is a question for a different day, but what came first, right? Was there some sort of switch in the configuration of their mouth that caused decreased information to come into that area, and as a result, they're trying to pull in to resonate that part? Is that a strategy that their brain's doing, or is it the mechanical actual trauma of just repetitively trying to pull air in and causing maybe some micro inflammation in that area, decreases and produces some sort of a neuropathy over time, and then they have decreased information in and they have to breathe even heavier to try to get more input, to try to get more information. Either way, it's not a good deal. And so the easiest thing you can do is start to work on your nasal breathing during the day and learn how to phonate on the way in and the way out with a relaxed neck for a long time. That will actually help you get diaphragm activity and abdominal activity. So if you do all that, if you were doing a squat and you put that all together, you're holding on, you have input from the hand, you're gonna inhale and exhale, and you have all that, you've just maximized tons of somatosensory input coming in. Better input in means better input out. And that's all for today's video. So give those 2 things a try, or those 3 things: nasal breathing, the phonating on the way in and the way out, nice and sustained, so you start to feel diaphragm and abdominals, and also squatting, holding on to something with your hands to maximize the hands. If you do all those 3 things at once, ton of input in, better chance of getting input out. Thanks a lot for watching today's video. I'm Greg Chaplin. See you next time.